What is thrombosis? First, I will explain a little the difference between arteries and veins. Both are our body plumbing. Arteries carry blood from the heart to the organs, veins send blood back to the heart. Sometimes the blood flow through these pipes slows down or becomes blocked, or there is damage inside one of these pipes. That's when a clot occurs, i.e. thrombosis. And is it serious? Thrombosis is a serious medical condition that occurs when a blood clot forms in a vein or artery, preventing the normal flow of blood. Signs and symptoms of a thrombosis include swelling, pain or tenderness in the leg, a warm or red area, and veins that are larger than normal. What thrombosis can lead to depending on where the clot is. Even if the thrombosis itself is not fatal, as it happens in the legs, venous thrombosis, deep veins, DVT, blood clot has the potential to break free and travel through the bloodstream, which we call embolia, and can lodge in the vessels of the lung, thus pulmonary embolism. I made a video about pulmonary embolism, and I'll leave the link at the end of the video. What are the types of thrombosis? Thrombosis can be arterial, when there is this clot in the artery, and limb ischemia can occur, for example the foot, and lead to amputation if not treated in time. And the most common, venous thrombosis. And in this video, I'm going to talk more specifically about venous thrombosis. What are the symptoms of thrombosis in the legs? Some people may not feel anything, but that's the minority. Most people will feel like they have something weird in their leg. Sometimes it feels like pain. Muscle. But be careful if you have swelling of one of the legs, leg pain or tenderness that may only happen when standing or the person walks. The area of the leg or arm that is swollen or painful, it may be hotter than usual, red or discolored skin, veins close to the surface of the skin may be larger than normal. If all or some of the symptoms are present, see a doctor to assess whether it is really thrombosis. What are the causes or risk factors for a thrombosis? Many things can increase the risk of thrombosis. Being over 60, although it can occur at any age. Person who sits for long periods of time, such as when driving or traveling by plane. Why? When your legs remain stationary for hours, calf muscles do not contract. Calf contractions help blood circulation. The blood getting stopped, what happens? Increases the risk of clot. Prolonged bed rest, that person who stays in the hospital or had paralysis. Same thing, does not move, risk of clot or thrombosis. Trauma, that person who sprains his foot, who was hit by a cart in soccer. It damages the vessel, coagulates, thrombosis. Surgeries, is going to have plastic surgery, has a pulmonary thrombosis. Surgery increases the risk of blood clots. Pregnancy. Pregnancy increases pressure in the veins of the pelvis and legs. Birth control pills or hormone replacement therapy. Being overweight or obese. Excess weight increases pressure in the veins of the pelvis and legs. Cancer. Some forms of cancer increase blood clotting. And people who are undergoing cancer treatment are also at increased risk. Cardiac insufficiency. Genetics. Some people inherit genetic risk factors or disorders, such as factor V Leiden, which makes blood clot more easily. The causes are several. What is the difference between deep vein thrombosis and superficial vein thrombosis? Superficial venous thrombosis, also called phlebitis or superficial thrombophlebitis, it is a blood clot that develops in a vein close to the surface of the skin. These types of blood clots usually do not reach the lungs, unless they first move from the superficial to the deep venous system. What can thrombosis pulmonary cause? Embolism. But there is also another syndrome, which is the post-thrombotic syndrome, which is characterized by pooling of blood, chronic swelling in the legs, and ulcers in the legs known as venous stasis ulcers. How is thrombosis diagnosed? The two main ones are on physical examination. We can identify most of the time. The calf becomes caked, hardened, and there are some signs of thrombosis. And another main exam is the Doppler, which will check the blood flow in the arteries and veins. How is thrombosis treated? Usually with anticoagulants, which will thin the blood. But your doctor may recommend other treatments, such as stents and thrombectomy. What about the Oxford vaccine? Can it cause thrombosis? Is it risky? The risk is rare, but it exists. In more than millions of doses used, so far they have identified 86 cases that may be associated with the vaccine, and 18 were fatal. But you see, the coronavirus itself can cause thrombosis, stroke, heart attack. I've seen a heart attack due to COVID, I've seen countless pulmonary thromboses due to COVID. So the risk of you getting infected by the coronavirus and having a thrombosis is much higher than you have a thrombosis because of the vaccine. And, of course, if you have a high risk of thrombosis, such as a hereditary factor, already had previous thromboses, choose vaccines that do not run this risk, such as CoronaVac, for example. Did you like the video? Did you learn about thrombosis? Remember to share so that more people have this knowledge. Remember to subscribe. And until the next video.